This is Dr. Daniel Paul, orthopedic surgeon with EZ Orthopedics, and today we're going to talk about how to tell if you have mild, moderate, or severe arthritis. If you like this video, we put out new content weekly, so please like and subscribe. So the first thing I want to say about arthritis of a joint, which is basically, arthritis is wearing away of the cartilage. So the bones used to have space in between them, the cartilage wears away and they kind of touch each other, and with most people that causes pain. So I'll say that you might have terrible arthritis in a joint on x-ray and it doesn't actually hurt that bad. Or you might have a little bit of arthritis and it hurts terribly. So we don't really quite know why arthritis sometimes causes pain and sometimes it doesn't. So just because you have mild, moderate, or severe arthritis doesn't mean, that you really need to do a whole lot about it if it's not bothering you. If it is bothering you, yes, then you need to get a treated. But there's a lot of people walking around with arthritis in their spine and in their knees and they don't even know it and it doesn't even hurt them. But again, how to tell the difference. So basically, arthritis is a process of wearing away on the cartilage. If you were to actually look at the cartilage, they grade it starting out where it looks normal, and maybe it's a little bit soft, which you can only really tell if you're scoping a joint and you're putting a probe on it. Then you start to see it fissuring, then it can look like something like crab meat, and at the end stage is severe arthritis. It's actually totally gone and you can see the bone underneath. So obviously you're not going to scope every joint to tell if someone has arthritis. So you get an x-ray, and on the x-rays you can see how much cartilage is there and how it's not, and that will tell whether it's mild, moderate, or severe. With mild arthritis, the joint's just a little bit narrowed, nothing too crazy is going on. When you start getting to severe, like the joint space is basically gone, and you have osteophytes or little bony growths coming off in all directions and cysts, and the bone turns dense, because when the bone rubs it turns denser on x-ray, and they'll be like, oh, that looks like bad arthritis and that looks like mild arthritis. Again, the whole thing to consider here is that some people will have severe arthritis on x-ray and not that much pain, and some people might have mild arthritis with a lot of pain, and again, we don't know why. So really, when you're getting treatment, you want to treat you don't want to treat the x-ray. So I hope I was able to answer your question on how to tell if you have mild, moderate, or severe arthritis. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you medical advice about your condition. Again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.